guys, and thanks for tuning in again. This is Dr. Joe Brown, the naturopathic doctor that everybody knows as kind of the cancer naturopath. Obviously, we specialize in a lot of stage 3 and terminal cancer situations from an alternative standpoint. Many people also come here, though, for a bunch of other chronic inflammation and diseases and conditions that they're having a hard time with from their other doctors and conventional standpoint. What we're going to do today is actually, I've had a lot of people who have contacted me both through YouTube, Google, our website, drjoebrown.com, as well as our phone number, asking me, I'm just first diagnosed with cancer. What kind of diet protocol should I be on? What kind of food should I be avoiding? What kind of things should I be doing more of? And so we've had so many questions regarding this that I wanted to take a whole video today just for a few minutes here and kind of go over some initial things for people to avoid and for people to do more of when you're diagnosed with, whether it be an early cancer situation, whether it be a terminal cancer situation, and most importantly, to avoid cancer, to avoid getting cancer from the prevention standpoint. So things that I really want you guys to avoid is any kind of sugar, and that means high fructose corn syrup, fructose, glucose, sucrose, and you even want to reduce a lot of the fruits that you may be eating. So you want to, depending on the type of cancer you're dealing with, we really want to get the blood sugars down as low as we can without going hypoglycemia. The second thing that we want to avoid here is any kind of salt. So that means sodium on labels, table salt, deionized salt, any kind of sea salt of any kind. So essentially we want to really get the sugar and salt out of your system here. Now, the reason why those two things are big, and again, you can Google a lot of this information on certain cancer protocols that come from Europe and Germany and places like this, but we want to get anything out of the body that will enhance cancer doing its thing. Now, a couple other things that you're going to really want to avoid are things like dairy products and any kind of wheat products. Dairy and wheat are they're the two most allergenic foods on the face of the planet. So if you're consuming dairy, whether it be yogurt, ice cream, milk, cottage cheese, things like that, anything that's dairy, and any kind of wheat products. So even when you're talking about 100% wheat bread or things that you would consider are normal for you, what happens is that when you ingest these type of foods, you're actually creating inflammation in the gut. And so if you're trying to do any kind of therapy, whether it be from an oral supplementation standpoint, intravenous IVs that you may or may not be doing, acupuncture, or anything else that you're doing to try to enhance the immune system, some of your white blood cells are actually migrating down into the gut area, trying to deal with the inflammation from the dairy or the wheat products that you might have consumed a couple hours previous, or even maybe a couple days previous to this. So getting rid of the dairy and wheat is huge. Now, another big elimination here is going to be some of the meat products that you're doing. Obviously, when you consume meat, especially red meat, it's known as an inflammation type of food. So you really want to get rid of a lot of the meats in a lot of the proteins, a lot of the meats in your diet. So red meats, porks, chickens, things like this. And if you're going to be getting your protein sources in there, it's always better to be recommended some things like fish, like salmon or any kind of white fish. And if you're going to do any kind of chicken, again, it probably needs to be in a minimal aspect throughout the week here, and it definitely needs to be organic, cage-free, hormone-free, things like this. So again, from the meat aspect, now a lot of people say, well, how am I going to get my protein? Well, you need to remember that a lot of your proteins that you're getting in your system, you can get through a lot of vegetables. If you're on a juicing protocol, which I always recommend for people, you're going to be getting a lot of that protein in as well. So and then we can also supplement a lot of protein powders. So the concern is that people don't want to, especially, and your doctors are usually telling you, don't get rid of your protein 100% because then you're going to start losing muscle mass, your energy levels will go down, things of that nature. So we need to make sure that if we're reducing some of these meat products, which is going to have a lot of that protein in it, that we're obviously supplementing a lot of other proteins into it. And then really one of the last eliminations we want to get rid of is some of the bad oils, or what we know as the bad oils, things like canola oil, and any kind of the margarines and things of that nature. So we really want you to switch over to things like a coconut oil, or preferably an extra virgin olive oil. But again, you need to really lightly cook with those things or saute something. You really don't want to use them too long when you're heating those oils up here, okay? So those are really the foods that you want to avoid. No salt, no sugar, no wheat, no dairy, and definitely reduce your meat content, okay? Now, when we're talking about foods that you want to do a lot more of, we really want to put you on a very heavy juicing protocol. And again, we're going to be shooting some specific videos on what juices I want you to do for certain conditions, whether it be you have cancer, you have high blood pressure, you're trying to lose weight, you're an older female who just can't seem to lose some of this weight. So we're actually going to be putting together some videos that are specific with certain juicing protocols to accomplish what we're trying to do here. But from a cancer standpoint, or more importantly, an immune standpoint, things that we want in the juice, as long as there's no other chronic conditions like thyroid issues or things going on, we really want to enhance or increase the cruciferous vegetable content like broccoli, red cabbage, Brussels sprouts. You can throw asparagus in there, beets, carrots, apples, as long as they're organic. You can also throw some cucumbers, tomatoes, garlic, onions, ginger, turmeric, things like that into there. So we really want to go heavy on the juicing, the organic foods, the organic vegetables, and really get a lot of the mainstream American diet type foods out of our diet. So again, we're going to be going a lot more into this on a number of other videos here. So, but I just wanted to kind of spend a couple minutes here when it comes to what foods do we really want to get out of the diet, what things do we want to do more of. Again, we want to get rid of sugar, salts, dairy products, wheat products, and a lot of the meat products where they're going to have all those extra hormones into it. And we really want to switch you over to an organic, vegetarian type diet, along as we're supplementing that correctly with a lot of other supplementation from an oral standpoint, IV treatments, acupuncture treatments, and things of that nature. So again, I'm happy to answer any of your questions, and if you guys have things specifically you want me to answer, make sure that you sign up for the YouTube videos. Just click on the subscribe button, and then you can also go to my website, which is drjoebrown.com, and that's doctor spelled out, drjoebrown.com. I'm happy to answer any of your questions. Obviously we get pretty busy in here with all of our patients, but I'm on the email and I'm on the website pretty frequently. We have about 40 to 50% of our patients that are coming in from other states and other countries for therapy, or for questions on therapy, or questions just from what their mainstream medical doctors are doing. And just like I always tell you guys, is that even though I'm a naturopathic doctor, went through 4 years of a naturopathic medical school, all my 3rd and 4th year rotations were spent with a medical oncologist. So if you're currently dealing with a cancer situation, I not only work with the doctors that are in the hospitals, but a lot of my friends and colleagues are medical oncologists. So we can and will work with your medical oncologist. So this isn't like I'm telling you come over and only do these treatments. The therapies and things that I recommend are always in conjunction with your mainstream doctor, so that it's essentially the best of both worlds for you. So again, I'm Dr. Joe Brown, happy to help you guys, happy to be back. Thanks for all the subscribers. Click on the subscribe button and I'm happy to answer any questions that you guys have. Have a good day.